These days, it can be hard to trust the media. What's true, what's fake, and who is behind the message? I'm a freelance journalist and videographer who has spent years studying the media. Now I'm taking a look at what local, regional, and national news stories mean to us here in North Central Washington. I'm Dominick Bonny, and this is Common Sense. Hello, and welcome to another episode of Common Sense. I'm Dominick Bonny, and this week we're going to take a look at a weekly food bank and health clinic that has been providing economic lifelines to an underserved but important population in our community, immigrants and undocumented workers. But first, I want to take a moment to talk about media literacy. It's something that so many Americans struggle with, and it's not totally their fault. We have been conditioned and accustomed to seeing opinion columnists and pundits as anchors and news reporters. They are not the same thing. Sean Hannity and Tucker Carlson are not reporters, and neither am I. I am an opinion columnist, and this is a news and opinion show. That means I talk about the news and include my analysis and opinion about current events. That's why there's a disclaimer at the beginning and end of this program that says as much. It's important to pay attention to those sorts of things. Now, I understand that my last program about the insurrection that Donald J. Trump incited, which resulted in the deaths of 5 people, and the historic and unprecedented second impeachment of an American president, ruffled some feathers. And that's okay. But the reason that I wanted to address this issue at the beginning of this episode is because I'm planning to devote an entire episode to media literacy in the near future, and another to the history of American journalism and the role that columnists and opinion writers played in it. But in this episode, I've dedicated this time to focusing on a group of people who have stepped up during the pandemic and parallel economic crisis to provide essential information, services, rent assistance, and even groceries to immigrants in our community who were already on the margins economically and politically, but who are now on the razor's edge, struggling to pay their bills and put food on the table. I visited the Saturday clinic and food bank and spoke with a few of the organizers, and my first interview is with Dr. Karina Vega-Villa, who is a math and engineering professor at Wenatchee Valley College, which is where the clinics have been taking place. Here's that interview.
We came to realize that people were having a lot of problems accessing basic needs, and so the idea is that hopefully we could use this community health model to transition into the COVID vaccination that is starting in the community in February. My name is Karina Vega-Villa. I'm the program director of the Mathematics, Engineering, and Science Achievement Program here at Wenatchee Valley College. I'm also the co-founder of the Immigrant and Latinx Solidarity Group. And this is a group where we coordinate efforts regionally to respond to the COVID pandemic in the Latinx community. And this is how we came to organize the event that we are having, the events we're having every Saturday. We host community health clinics where we offer resources to our community members who are most affected by the pandemic. We offer them health education, and we also give them access to free flu shots. All of us as volunteers and the people that participate follow COVID guidelines. We all have attestation forms. We interview every participant at the entrance to make sure that they don't have COVID symptoms. And we have a way to communicate with them in case there is exposure to COVID. We have a way to let them know that they've been exposed. And we have been here at WVC in the gym since December 5th. We will continue to offer these services until January 30th of this month.
So briefly walk me through the stations and what services are offered to people at each.
Sure. So after people have completed their attestation form, answering questions about COVID symptoms, we also ask them about their greatest needs. So we want to know what they are coming here for, and then they are able to walk through the different stations. First, they get to talk to our representatives from community CVCH. They come here to offer access to health insurance. They also can get health information where they learn about the flu vaccine, flu season, access to coronavirus information in simple Spanish language. We also give them information about preventive measures, and right now we're informing them about the COVID vaccine that is available in the community. Then they move on to the flu shot table, where they have nurses or nursing students that are going to help them with that process. And the last station are the most popular one. So we have interviews for rental assistance and utilities assistance, and also access to fresh food that is culturally appropriate. And once they have received those services, they are done with our event.
So they come through, it's a one-way traffic flow kind of a thing. And the rental assistance, where does that come from? Actually, maybe we could talk about the money.
Yes.
How is this funded?
Yes.
Who's sponsoring it? Where does the rental assistance come from? The groceries, etc.
Yes. So the reason why our community members come to the clinics are mostly access to rent and food support. The rental assistance program is through Wenatchee for Immigrant Justice. They are part of a network in the state of Washington, the Washington Immigrant Solidarity Network. And through that network, they were able to obtain a $50,000 grant to distribute to immigrant community members. They ran out of funds last week. And so right now we're still interviewing community members for a waiting list. And we have volunteers that come every week to do the interviews here. And then the volunteers will give them a call after a committee evaluates their case, and will tell them how much of the funds they will receive. We also have food assistance. This is fresh food. So tomatoes, chiles, tortillas, avocados, lime, food that is meaningful in the Mexican culture, which is the largest population here in the Valley. And these are donations from 2 local doctors. We have Dr. Maria Rojas at Confluence Health doing a personal donation with her husband. And we also have Melia Botriel and her husband, Tony, from Leavenworth, who are also doing donations every week to provide to our community members.
Wow. And how much groceries do you give away every week?
We always run out of food. We have roughly $400 of food that go out every week. We started since December 5th with these donations that our doctors here graciously have been provided. This is committed until the end of the month. Since our clinics are ending at that time, we're looking for ways that we can continue to provide those much needed services for both rental assistance and food assistance to the community members. So we're looking for funds and organizations that can partner with us to make sure these services continue. We serve community members who are undocumented. So there is a gap in service if we are not asking the right questions in a way that is not jeopardizing their immigration status. So all of us came together to create a list of resources that we knew was accessible to the undocumented community. And we continued to meet to make sure that we had a good list of resources, and we quickly identified gaps in services. And we were able to work together and collaborate with organizations and public offices to make sure that we are addressing those gaps in services. So since April, the Immigrant and Latinx Solidarity Group has been serving as that place where all of us get together and get to hear about the things that are working and are not working, and then we collaborate with the broader community to respond to the needs. So that's probably one of the positive things that came out of this pandemic, that we were able to form this coalition of nonprofits, grassroots effort, grassroots groups, volunteers, lawyers, educators, all of us coming together to serve the needs of the community. It is estimated that 30% of the community in the region is undocumented. So they work in our businesses, they work in our industry, they keep the economy going. A lot of them have essential work, essential jobs. So they have been keeping the economy up and running in the state of Washington. And that's also true for our area here. And so they have not received a stimulus check. They cannot receive any access to federal support locally and at the state level because of efforts from grassroots groups like Wenatchee for Immigrant Justice and the broader network, Wenatchee for Immigrants, Washington Immigrant Solidarity Network. They were able to lobby with the governor to get $30 million for the immigrant community. Those were funds that were offered later in the year, around December. They were distributed to the immigrant community through different networks that are supporting the immigrant community members in different parts of Washington. So here in Washington, we have had those efforts thanks to the efforts of grassroots groups that understand the value of our immigrant community here. They are an integral part of our community. They are picking our apples, they are cleaning our tables, they are cooking our food. So we need to support them and helping them access food, money for rent and for food is the least that we can do to honor what they do for us.
Absolutely. They're a pillar of the economy. Mm-hmm. And the fact that they are applying for rent help means that they have still been paying their rents throughout this, even though there's a moratorium.
Right.
Right? But renters know that even if there's a moratorium right now, it's going to end sometime, and all that back rent is going to come due, and I'm going to get evicted. Mm-hmm. So there's this. So I mean, they're not paying their rents. They're actively trying to pay their rent with fewer, like you said, fewer hours on the job.
Yes. What we've learned through our interviews that we do at the beginning of our clinics is that 51% of the participants are in the agricultural industry, 25% of them are unemployed, and roughly 10% are in the hospitality industry. And then we have other services and retail and healthcare that are lower than 10%. And so what has happened is that they are underemployed. Their hours have been cut. So if they were in the past living paycheck to paycheck, now that paycheck has gotten smaller. So they need to have a way to access funds so that they can fill the gap and be able to pay for their rent and get food on their table, which is very interesting because they are the ones that are picking our food and making our food, but they themselves don't have access to fresh food.
Yeah, the irony.
Yeah.
It's like a Dickens novel or something.
Right.
Well, my last question is there anything that we didn't cover in this interview that you would like to speak to?
We have been fortunate to collaborate with partners like Pinnacle Preps, CBCH. We've also had the Community Action Council come earlier during our clinics to offer food boxes. We also partner with the health district. They are the ones that are offering the vaccines, the flu shots. And hopefully we can start collaborating with Confluence Health when we start using this model for COVID vaccination. So this is a collaborative effort. You may see a couple of faces that are the ones talking about what we're doing, but this is a collaborative effort to support a community that has been hit hard by the pandemic. The pandemic has simply made obvious what we already knew. Social determinants of health are responsible for those disparities in health outcomes, and those are associated with socioeconomic disparities that are huge here in our region. So any future efforts need to be collaborative and need to involve Latinx community experts and members, so that any plan that we have is from the beginning addressing those disparities so that we can access the people that are affected the most.
When Mike leaves town, it's a little scary. You never know who might be outside. But we feel safer inside knowing our home is being monitored by a local company. I can check our alarm from just about anywhere, so when we get home, I know it's safe.
Protect your family and save money with a local company. Switch your current security monitoring to Guardian Services from LocalTel. Call Guardian Security from LocalTel now, or visit localtel.net to learn more.
There are so many possibilities for you to learn local right here at Wenatchee Valley College. Take classes towards a degree or certificate in more than 50 areas of study. Wenatchee Valley College now offers a large variety of virtual classes, including labs, sign language, music, and machining, and they have the resources to help you succeed in virtual classes. So when a college degree is your goal, learn local at Wenatchee Valley College.
Hello, North Central Washington. I'm Dave Tosh, Executive Director at Wenatchee Valley Senior Activity Center, and I'm excited to announce a new variety show entitled Vibrant Living, brought to you by the Senior Center. And I think you'll find it educational, informative, and a lot of fun. Join us in early November for the new program, Vibrant Living.
It's estimated that 1/3 of Americans do not have a financial plan. At D.A. Davidson, their advisors are working to change that because they understand the importance of planning for the future. At D.A. Davidson, they believe in partnering together to build a strategy tailored to your needs. They spend the time and have the knowledge to help keep your financial future on track. Let D.A. Davidson Financial Advisors of Wenatchee put the strength of advice to work for you.
Welcome back. While I was at the food bank and free clinic, I spoke with a few of the other organizers, including Teresa Bendito, about why she volunteers her time to help the immigrant and undocumented community in our region, and what unique pressures they are under because of COVID-19 and the total failure by our national government to respond in a competent and humane manner to this crisis. Here's that interview.
Can you speak to what are some unique ways that this crisis and pandemic has impacted this community?
Yeah, so as we all know, COVID has affected everybody, but as for the undocumented community, they are not able to access things like unemployment, and many of them do not have access to healthcare. So this has really put our undocumented neighbors in this different situation in which many of them have described it to be much harder than to also access of any other resources. And they were affected, but even more than people who had that ability to receive a stimulus check, if they were laid off, have access to unemployment. And so this is the reason why we have jumped into the action and helped our neighbors in this way. So we are right now trying to ensure that this space is going to be one where the COVID vaccine is also available. We really want to make sure that our Latinx community has the ability to receive the COVID vaccine in equitable ways. We've learned a lot during the course of the last couple of months where we know that equity needs to be at the forefront in the distribution of vaccines, in helping the community know what kinds of assistance is available to them. And so I think that one call to action for people is definitely to be asking questions about how equity is going to be at the forefront of the COVID vaccine distribution. How are our undocumented community going to be able to have access to these vaccines, and about our agricultural workers? We know that they are at high risk in the places where they already work, in the warehouses where ventilation and circulation is hard because of the environment they're in. And so I think that is a big call to action, ensuring that our community is also, looking out for each other and ensuring that we are holding institutions and representatives accountable for ensuring that our most vulnerable population is receiving the vaccine and education. Yeah. I would just like to thank the Wenatchee Valley College and CVCH, the MESA program, generous individuals that are helping in making sure that this place is available and for our community. And that's all. We can't do it without support from everybody.
I also spoke with Malia Butrell, the lead faculty member for the RN to BSN program, and one of her students who has been administering flu vaccines and educating the public about their health as a part of her practicum project. Let's hear briefly from them before we go to another break.
My name is Malia Butrell. I am the lead faculty for the RN to BSN program in the nursing program here at Wenatchee Valley College. And we have two RN to BSN students, Nayeli Vega and Daniela Dercio Gaspar. And they are, for their project, providing flu vaccines with Parque Padrinos. And we have given about 150 vaccines. They are both bilingual and bicultural and are able to speak to the patients here in Spanish, which has been a really nice thing to be able to provide. The last thing I wanted to say was that I am really proud that Wenatchee Valley College is providing the space for us to be partnering with Parque Padrinos and the nursing students. And then the last, I guess the other part, you can cut this out too, is that the vaccines are coming from the Chelan Douglas Public Health. They're providing us the vaccines and some of the education, the patient handouts that we're giving to the public. And then the nursing students are also providing health education around flu vaccines, but also other questions that people might have, and then doing education on COVID infection.
My name is Nayeli. I'm an RN to BSN student here at Wenatchee Valley College, and I'm here providing flu vaccines and education regarding our Latinx community. And this is part of my practicum project at the BSN program here at the Wenatchee Valley College. And it's very important that we reach those people in our community and educating them more about flu and how important it is that they receive their flu vaccine, especially during these times during COVID-19.
And how many vaccines would you say, ballpark, you've personally administered?
I've administered approximately in total 30 or 40. We've done some here at Wenatchee Valley College, and as well as the Lighthouse Ministries with the Hope Clinic. We got a few people there as well who received their flu vaccine.
Great. And how close are you to completing your program?
We're currently in our winter quarter, so we'll have our spring quarter and then we'll be done.
Great. And then you graduate?
Correct, yeah.
Oh, nice. Congrats.
Thank you.
And then what's next for you?
I just want to get more nursing experience. I'm here in Wenatchee and just keep on learning more.
While it may be hard to resist those big brown eyes and pleading face, many people aren't aware that people food can be dangerous to pets. And it's not just because of the added weight gain. Some foods are downright dangerous, including chocolate. For a detailed list of dangerous foods, go online to pawsandclawsvh.com. If you suspect your pet has eaten something dangerous, please call Dr. Shauna Baez and her staff at 888-PAWS, as your pet's health is important to us.
It's estimated that 1/3 of Americans do not have a financial plan. At D.A. Davidson, their advisors are working to change that because they understand the importance of planning for the future. At D.A. Davidson, they believe in partnering together to build a strategy tailored to your needs. They spend the time and have the knowledge to help keep your financial future on track. Let D.A. Davidson Financial Advisors of Wenatchee put the strength of advice to work for you.
Mary Maids of Wenatchee has been professionally cleaning and sanitizing homes and businesses in North Central Washington since 1998. Mary Maids uses commercial-grade cleaners and viricides. Mary Maids has implemented additional safety and sanitation protocols. They are strictly following CDC guidelines for the safety of their clients and employees. For expert help with cleaning and sanitizing your home or business, call or look up Mary Maids of Wenatchee to schedule your free estimate today.
The Performing Arts Center,
the mountain bike trails. When I ride the Loop Trail, we've all been lifted by the giving generosity of our community. I think philanthropy is everywhere.
I'm just overwhelmed with gratefulness.
There is such a legacy of giving in this community.
And that's a direct impact on my quality of life.
And we have the duty to kind of do the same thing for our future generations.
Welcome back. Throughout this pandemic and the economic crisis that it has led to, I, like many, have had to fight the tendency to feel sorry for myself or angry at people or things outside of my control. But when I get in that headspace, I try to remind myself that for so many, things are much, much worse. I try and think about the old people and those with health problems that make them prime targets for COVID-19, or the undocumented workers, most of whom are deemed essential on one hand, yet have to live their lives in fear on the other. They make up a large minority of the population in our region and in many agricultural areas. Yet they find themselves on the margin even more than ever in a crisis like this, lacking a streamlined, speedy, and affordable pathway to citizenship. So they live in a sort of limbo, not even enjoying status as a second-class citizen. They have to worry not just about ICE, catching COVID, and diminishing work hours. Now they have to worry about being able to put food on their table and feed their kids. This is a supreme irony, since many of them, as essential workers and an essential part of the supply chain, put food on yours and mine. Throughout this crisis, it's been interesting to see what people spend their time doing. Some people decided that putting on haircut protests or filing lawsuits that wasted the court's time and other people's money was a good use of their time and energy. Those folks will be remembered as the fit throwers and time wasters that they are. But others, like Dr. Karina Vega-Villa, Teresa Bendito, and the other organizers who made this free clinic and food bank a reality for this underserved and overlooked community, I think, will be remembered as the change agents and philanthropists that they are. And I hope that this episode and the other media coverage that this program has received will stand as a testament to their charity, humanity, and honor. I'd also like to give a shout out to the Wenatchee Valley College for pivoting and using a facility originally designed and designated for athletics. And now it's being used to provide a space for economic relief and essential healthcare information to our immigrant and undocumented community. Like Dr. Vega-Villa said, this was a coalition effort, and if this plucky group of organizers, educators, and activists can make this free clinic and food bank a reality, what is stopping our local elected officials and governments at the city or county levels from following their lead? The course has been charted. Now it just takes the willpower and courage to follow. I'm Dominick Bonny. Join me next time for Common Sense.
Hi, I'm Corey with Rose Tractor, and you're watching the NCWLIFE channel.